Hi, welcome to Santa Ana College's supplemental programs for your health and fitness. My name is Daniel Liguera, Assistant Professor at Santa Ana College Department of Fire Technology. The purpose of these programs is to serve as an educational tool, to equip you with the knowledge, the tools, and the resources you need to maintain healthy through all these different auxiliary programs that we have available to you. We're going to have Charlotte Vance talk to us about nutritional assessments. Michelle Adams is going to talk to us about building resilience. Stephen Leiro will talk to us about injury prevention, and I will come at the very end to speak about the tactical strength and conditioning. As enrollees in Santa Ana College's health and wellness program, you have access to what the college calls office hours, where you, as a student, can have access to your instructors to discuss in more detail your nutrition, your resilience, your injury prevention, and your tactical strength and conditioning. Charlotte Vance is going to talk to us and begin with nutritional assessments.
My name is Charlotte Skeen. I'm a registered dietitian, and I am here to talk to you a little bit about our nutrition assessment program. Some of the services that I offer as a registered dietitian are typically based on a couple different factors. So one of the ways in which I meet with clients, firefighters, etc., is through individualized consultations. And these individualized consultations are typically one-on-one or very small group environments. Our individual consultations are typically based on information provided in your fitness test or from some other medical practitioner, or based on goals that you personally have developed for yourself. Generally, this program will go over your body composition, height, weight, body fat percentage, and the goals surrounding that. Are you looking to gain or lose weight? Are you looking to maintain? Are you looking for overall fitness and performance? What does that kind of look like for you? Then from there, we can also talk about blood labs. So during your annual fitness test, you will kind of get that report of your laboratory values. We can talk about things like improving cholesterol, glucose, reducing heart disease risk, diabetes risk, etc. From there, kind of whatever pertains to you personally. Something else that I find is extremely important for this population is inflammation management. So working on a diet that is anti-inflammatory to reduce aches and pains and stressors. So as we kind of test things like CRP, C-reactive protein, we're noticing over time that there are higher levels of inflammation in this population. So what can we do to kind of counteract that? And that's what we choose to do with things like diet. Aside from that, we also talk about meal planning. So if that's something that you are interested in, whether it's an outline of what to eat at what point of the day and how best it can serve you, or if it's just a general guideline of how much you should put on your plate in what portions, that's what I'm here to do as well. I'll kind of take into account your physical activity level in all of this. Are you sedentary, lightly active, moderately active, heavily active? Is there something that you're training for or a program that you're choosing to follow? That goes into all of your goals as far as what we do with nutrition and how we kind of develop an individualized plan for you. I'll always look at existing injuries, right? So that goes back to that inflammatory piece. Are there existing levels of inflammation, little aches and pains that we want to try and address in a food first method as much as possible. And then last but not least, that stress level piece. So we all go through varying levels of stress day to day. It's just something that we can't necessarily avoid, but how well are you recovering from it, right? So we don't always want to be constantly living in this level of high stress. We want to be able to bring it back down to baseline. And the way that we do that is through stress management, good exercise habits, but also it can be on a systemic level from the foods that we choose. So these are all things that we would talk about in that individual consultation. So aside from that, just to dive a little bit further into kind of the nitty-gritty of the main things that I talk about, the in-depth review of blood labs is extremely important. So obviously we have values like cholesterol, glucose. Those are kind of the main ones that we target, maybe even triglycerides. And that is basically making sure that you have good longevity in your heart health, in your blood sugar management, reducing risk for chronic disease down the road. That also can then in turn develop what your meal plan looks like. So are we incorporating high fiber to help reduce cholesterol? Are we incorporating different methods of blood sugar management? That is kind of all what's played into that as well. Then we talk about meal planning specifically for athletic events, right? So maybe you tell me you're running a marathon and you need to know how to properly fuel your body so you can not only make it through that race, but recover well day after day so that you're not kind of feeling sore and sluggish and burned out while you have to go through this training program. Aside from that, body composition improvement changes, that's a huge one for my world, right? So a lot of times what I'll see is, how do I lose body fat percentage? How do I gain muscle mass? How do I make sure that I can keep weight on while I'm in this period of high intensity exercise, etc.? So whatever that may look like for you, it kind of takes into the account of your specific training goals. So what you're already doing or what you plan to do. And then what kind of that looks like going further, right? So how do we need to change what you do on your day-to-day dietary lifestyle to make it so that you are still feeling fueled and well taken care of and not fatigued, but then also reaching towards your goal day by day, meal by meal. So something cool that we have kind of as a service for you is our Smartabase nutritional tracking. So as much as you can go on Smartabase and find your fitness test results from the years prior, we also have a nutrition dashboard. And what the nutrition dashboard does is it keeps accountability and it keeps the conversation going between us, even when you and I may not be present in the same room. And the way this does that is, I have a portal that I can log into, you have a portal that you can log into, and we can see each other's notes along the way. So basically what this can do is I can say, hey, I'd like you to put in a food log, right? So tell me what you eat on an average day. And you go plug it in day by day, meal by meal. I can see it. I can give you some personalized feedback, change this, change that, you're doing great, change nothing, whatever it may be. It also allows us to track progress over time, right? So we can see from year to year, fitness test to fitness test, what your data is, but also we can plug in extra points. So if you know your body fat percentage, your weight change, that can kind of get logged over time, and you'll see that in a graphical format. Then from there, as we continue to meet and develop our program and our plan, we can modify our nutritional strategies and our goals based on the results that you're seeing. So we can kind of see where we started and where we're progressing along the way, hopefully seeing the results that we'd like from that. Those individual consultations that I mentioned in the very beginning are typically one-on-one, confidential, highest individual approach, kind of targeted to you and yourself specifically. From there, typically it is a phone conversation, potentially a Zoom meeting, or an in-person at the station. That's completely up to you. If any of those interest you, just kind of let me know. They will often involve periodic follow-ups so that we set our main goals in that initial meeting, and then weeks or months down the road, I'm checking in just for accountability's sake and to make sure that the program that we developed is what's helping you first and foremost to the best of its ability. Then, aside from that individual consultation, oftentimes we meet in groups. So whether it is an official formal class on things like immune health, performance nutrition, anti-inflammatory diets, anti-aging, or nutrition for the lifespan, we have all these things available to be able to bring to you in a formal group setting, oftentimes incorporating a PowerPoint and a lecture format. Aside from that, the group education can also be at your department. So maybe you have a crew that's all interested in some of the same nutrition questions. I'm more than happy to sit down with them as well. And just kind of round table talk, right? So some of the questions that we come up, conversations, discussions, maybe debunking some of the fad diets that are out there for this day and age, and just kind of going about and talking through whatever may come up culturally or for that department or that crew specifically. So the goal with group education is always to learn on and off duty nutritional strategies, talk about dietary habits that incorporate your high call volume, or maybe your late night calls, the ability to feel fueled, whether it's first thing in the morning or in the middle of the night. And we know that that's highly specific to this population. And the fact of the matter is, a lot of times your nutrition habits change dramatically, whether you are on shift or at home. So my goal is always to kind of address both pieces to that, because that's what makes up your day-to-day and your whole life, right? We can't neglect one. And so therefore we talk about both. So if you have questions about either, 100%, that's definitely something that we'd like to approach. The other thing that we kind of want to address all in all is just making sure that you have a long, healthy career, looking to reduce injury risk, maintain physical fitness, reduce risk of muscle loss, and maintain optimal body composition, right? So we know that we kind of have peaks and valleys through life of what looks the best for you, and you kind of know where you feel the best and function the best. Whether it's in an individual meeting or a group meeting, we can always kind of address that feeling as well, looking to make sure that you are your best self for on and off shift. All right, and then just a reminder, group or individual consultations, we have group nutrition lectures as well. The nutrition strategies are always based on your personal goals or what we kind of talk about in person. I'll let you generally lead the way with the questions that you have, and then I'll kind of work around to bring my expertise to the table there. We'd like to improve your blood labs and your body composition if that's something that you have issues with or find that it's a continued trend over time, maybe moving in that upward direction. We're here to kind of help assist with that, bringing that down before it becomes a chronic issue. And then ultimately, we want you to stay accountable, right? That's what we're here for. We're here for your continued help. It's not just a one and done type thing. Whether it's the Smartabase phone app or continued meetings over time, our goal is to help you to reach your goal, not just kind of leave you hanging in the process. So we are here for you. We will continue to be, whether that takes 1 meeting or 10 meetings or continued meetings from there on out, our goal is to make sure that we see through the achievements that you'd like to see nutritionally and otherwise. So again, I am the registered dietitian. My name is Charlotte. If you have any questions, please feel free to reach out to me or Chris or Daniel at any point in time, and they will point you in the right direction.
Hello, my name is Michelle Adams, and I am here to tell you a little bit about the SOAR program that we've created for Santa Ana College. So SOAR stands for Stop, Observe, Assess, and then Respond. So we really teach you how to move from that reactionary limbic part of your brain up to your frontal cortex or your frontal lobe, where you have access to the whole brain. So in other words, if you're cut off in traffic, the automatic response is to lock the arms, to clench the neck. Maybe there's some superlatives that come out of your mouth. The goal is here to teach you to breathe, to become aware in that moment and not react. So you don't send off that nasty email when your boss gets under your skin. You have that moment of breath to pause and really think about it before you respond, okay? By the time you're 35, 95% of who you are is unconscious. It's automatic. It's a set of programs that you're running every day. And to make things worse, you have between 60 to 70,000 thoughts in one day. And of those 60 to 70,000 thoughts, you've got 90% of those are the same as they were yesterday and same as they were the day before. And then of those, 75% are limiting. So all day long, you've got that person in the back of your head that you really don't want there, but that's creating these thought patterns in the brain that are not optimal for your physiology. We're going to teach you how to train your autonomic nervous system. What is your autonomic nervous system? It is anything that runs in your body automatically. So you don't have to think about telling your pancreas to release insulin as you've taken a bite of that hamburger. Your body's already doing it. Your heartbeat, all of that. The one component that you can control of your autonomic nervous system is your breath. And when you train your breath, we teach you how to train it, you become more resilient to your stresses. So in your autonomic nervous system, you have two components. You have the sympathetic or your fight or flight, where you feel like the tiger is chasing you, and your parasympathetic or your rest and digest. We want to help you train that through your vagus nerve. And you hear about vagal tone a lot. That's what we do when we're bringing you these techniques. We get the honor and privilege to bring you tools of heart math. HeartMath has done more research on the heart than any other organization in the world. This is what we bring to specialized teams in the military. This is what we bring to most police officers, especially in other countries. And this is what we give pilots when they're flying billion-dollar machines in order to make sure that they are coherent. So what that looks like is anytime that you are on the left side of this grid, anytime you're feeling these emotions, you're releasing cortisol into your system. And what we know about cortisol is your stress hormone. You need it, but when it becomes chronic, that's where the body breaks down. On the right side of the grid, these are renewing emotions, and they produce DHEA along with 1,400 other chemicals in the body, and those are known as the youthing hormones. So truly, we teach you how to be more neutral or on the right side of the grid. We teach you how not to get stuck in the left side of the grid. So then, when you are practicing this, I teach my students all the time, happiness happens when something in your external environment creates a situation that causes that emotion. But joy is a skill. It's practiced each and every day. So when we bring HeartMath tools to you, it looks like the Resilience Advantage. There's a full workbook that you go through. And then for our first responders, you also get this little pocket take home. A lot of our police officers actually put it in their pockets. So they have easy to access tools in the moment or right after an incident has happened. And if their brain is not thinking clearly, they can come back and review. For our group classes, we teach you things for your body, your breath, and your brain. Yoga type of courses. They improve your strength, your flexibility, and we train your vagus nerve. For your breath, we teach you whether you're breathing functionally or not, whether you have problems with anxiety or lethargy. We help give you tools to improve that. And lastly, we really help you focus on sleep, because that is one of the things that we know for our first responders that's key. Brain, we're going to teach you how to quiet the mental chatter in your brain, how to become coherent, and how to live from that state so that you can train your heart rate variability. And what heart rate variability tells us is that the minute that you've experienced a stressful situation, how quickly can you return back to your baseline, to your norm? Is it hours or is it days or weeks? And the goal is to make that time frame super small. In other words, you are on the left side of that HeartMath grid for a very short period of time, so you're renewing your battery instead of draining your battery. Then we also can provide you individualized training. So for strength and flexibility, for sleep, breathing dysfunctions, and any physiological and physical issues. So if you have problems with your shoulder and you have high blood pressure and you have diabetes or pre-diabetes and you've got issues with your sciatic nerve, those are the types of things that we would deal with, both the physical and the physiological, to get those situations resolved. HeartMath, we talked about, that's tools to optimize and create resilience and coherence. So you're walking around as a different human being. You're walking around as someone who's renewing your battery all day long, because you're not sleeping every night between 2 and 4 a.m. when your battery recharges. So we're giving you tools while you're awake to practice so that your job doesn't affect or negatively impact your physiology. And then lastly, I'm so honored to be able to bring this to the college. It's Dr. Joe Dispenza's Change Your Mind, Create New Results program. This program, up until now, has only been offered in corporate. So Google, Pfizer, Microsoft, Facebook, just recently, the United Nations, all have this information. Our first responders haven't had it up until now. So if you want to Google Dr. Joe Dispenza, you can look at his work as well. But we bring his training program to the college to teach you how to become the greatest version of yourself, to really walk as the person who you want to be and who you're meant to be on this planet. And lastly, meditation. So I want to leave you with this. Why is meditation so important? We exercise daily to help our physical body, yeah? But if we're not meditating daily, we're not improving the mind. And we know that 30% or more of Alzheimer's is preventable. Meditation, we know, prevents Alzheimer's and dementia. So just by doing 5 to 15 minutes a day, you're exercising your brain and you're improving your brain function. So then the resources that we offer, you have access to yoga instructors, sports psychologists, tactical psychologists, and firefighter testimonies and meditation. So thank you, and I look forward to seeing you soon.
Hello, Long Beach. My name's Steven, and I'm part of the wellness team from Santa Ana College. For the past 20 years, I've had the privilege to work with many firefighters from various fire departments. And it's been fun, and it's an honor to be with you guys, to take care of you guys due to the fact you do so much for society. Why not work with you guys? Why not help you guys to improve a lifestyle? For the past 19 years, I know you guys, studying you guys, working with you guys, and going on calls. I notice everything you guys go through. And I know many of you guys have chronic or acute injuries, you know. That's what this program is about, to help you guys to improve lifestyle and help you overcome those obstacles, hopefully to better movement patterns so you can even live better, not just in the personal life, but definitely at work. Our program goals, definitely to improve quality from a chronic injury to an acute injury. We have issues, we get stiffness, we get joints that don't move as well. One of our things that we want to do is create flexibility to those areas of the body that are tight because maybe not stretching enough or they're weak. We want to create flexibility. We want to create a strengthening. There's some areas sometimes that specific muscles are not stronger as the other ones. We want to focus on that. We want to focus so that the whole body as a whole will move better, and it allows you guys to create better pattern movements in their personal lifestyle, and definitely want to decrease the kind of soreness and the kind of pain that you may have. Okay, so yes, definitely all this to enhance better lifestyle. We want to create just a basic exercise program focusing on rehabilitation, in which you can do it anytime you want. You can do it at your house. You can do it at the station. You can do it even when you go on vacation. We can create something simple. For example, a stretching program on in and lower back prevention. Something very simple. All you would need is a floor, a rope, and then just a time to take care of your back. And the back will say, thank you so much for just taking care of me, you know, and that'll be awesome. Same thing for the shoulder. Basic stretches we can create, you know, to increase the mobility of the joint. Okay, so that's one part of the ways we can do it. Also, as you come to our program, or as we come and serve you guys, every student who comes through the injury prevention is going to get an education. We want to make sure you understand what's happening. What does your shoulder knee hurt? Give you guys a little bit of anatomy, a basic understanding of what's going on. Then, or maybe you guys want to do prevention. Maybe you're not hurting, but you know what? I'm doing pretty good. Can you show me how to prevent? Can you show me how to stretch better? Can you show me how to strengthen my body better so that we'll have no injuries? Or maybe you point out rehabilitation, where maybe a few years ago you had a knee injury, a back injury, a shoulder injury. Now as those pains and aches are coming back, what can we do about it? Then as the rehabilitation comes in, to create a program in which we can strengthen that area of the body, you know, following all the pathology and inflammation circles of healing, and from there, slowly rehab that area. So we have the education is a big factor always, and the prevention, and then the rehabilitation that each one of you guys will get as you come to our program. Every student, every fireman will receive a personal injury assessment. What's going on? If it's your shoulder, you know, we wouldn't look at your hips. We want to look at the movement of the body. Maybe vertical hold, rhythm alignment is working together. From there, as you're receiving therapy, sometimes you'll get manual therapy such as soft tissue, joint mobilization, and adjustment, so forth as needed. But definitely each one of you guys will receive a personal assessment so they can create an exercise program according to your needs. And of course, as you guys know, most of the areas that we see for injuries is going to be your lower back, your lumbar. We can have cervical, followed by the shoulder, knees, and ankle. Those are the most common ones, But please, let us know how can we help you. You've done so much for society. We want, on behalf of our Santa Ana College, we want to say thank you. Thank you for allowing us to come into your house and serve you, and hope to hear from you soon. It's a privilege. My name is Steven, and take care.
Hi, my name is Daniel Higuera. I'm back to speak to you about tactical strength and conditioning for the firefighter. In terms of this auxiliary program of the strength and conditioning for a firefighter, the purpose of this program is to identify or to create a needs analysis, to look at your left to right imbalances, to look at your injury and pain history and profile, and to look at your current fitness level. All of these will go into creating needs analysis and creating the program that's going to be best suited for you. When we create the strength and conditioning program, it will be specific to your current fitness levels. It will be geared to help improve performance on the fire grounds as a firefighter and to reduce that risk of injury, so building resilience. And also, we can focus on an individual, or we can focus on improving fitness as a crew or as an entire company. Our program focuses on improving and building resilience to injury. You put your body through a lot of stress when you're running calls throughout the entire day across the entire shift. We want to make sure that the body, the joints, the muscles are going to be resilient to the stresses that you're going to be putting upon your body. One way to do that is by improving your muscular strength, improving your muscular size, and improving your flexibility. We know that the job of firefighting does have high cardiovascular demands. We have to make sure that your body is capable of putting up with those cardiovascular demands, but also staying healthy at high intensity levels. And then lastly, we want to build a PT program that can help you improve energy levels. Exercise is known to increase energy levels, but more specifically, if we can find out through that needs analysis at what time of day is going to be best suited for you to PT and to work out, whether that be in the morning, afternoon, or evening, to help maintain and augment energy levels throughout the day. And by being part of Santa Ana College's Health and Wellness program, as an enrollee, you can receive expert guidance from a Santa Ana College exercise physiologist on how to improve your cardiovascular endurance, how to improve these muscular qualities like muscular strength, size, and flexibility, how to decrease body fat percentage and improve body composition, but most importantly is to build resilience to injury. We want to make sure that your body is doing the job well, keeping up with the stresses of the job, not just in the short term, but across your entire career. On an individual basis, because our program can be tailored to work with the one-on-one or as a group, as a company, or as a crew, we can look at the exercise equipment that's available to you at your station and or also at your home. The program can be sensitive to the call volume at your station. Perhaps you have more time to PT in the morning, afternoon versus the evening. Maybe you only have 20 minutes, or maybe you even have the luxury of working out for 30, 45, or 60 minutes at a time. Regardless of what that situation is, we can formulate a PT program that's going to be sensitive to these call volumes, giving you days of PT where if you only have 20 minutes, you can get a well-rounded PT session in those 20 minutes. And if you ever have longer periods of time, say 45, 60 minutes, you'll also have PT workouts that are going to be appropriate for the longer time periods. And we can formulate a PT program that's going to be available either 1 time, 2 times, 3 or 4 times per week. And we want to make sure that we're tracking your workouts over time. Santa Ana College is on the verge of launching a remote coaching app, where this app will allow exercise physiologists like myself who have an expertise in working with firefighters, and where we can program either 1 through 4 days per week of PT, again, short workouts versus long workouts, that's going to be sensitive to call volume and also to the equipment that you have available at the station. So you no longer have to think and come up with your own PT workouts. Now you're going to be under the guidance of a Santa Ana College exercise physiologist, where I myself can program from my computer your PT sessions for the next 4 weeks, 6 weeks, or 8 weeks. These PT sessions will be programmed so they can help you improve muscular size, strength, flexibility, cardiovascular endurance, and also build that resilience. So then now you can just open up your phone and look at what Daniel has prescribed for you. You can look at all the exercises, the recommended sets, the reps, along with the recommended weights. And then this app will automatically progress these workouts for you on a week-to-week basis so that your body remains adapting to these new accumulating stresses so you can continue building the resilience that you need to keep up with the stresses of the job. As a quick summary, for the tactical strength and conditioning portion, we can individualize these programs on a one-on-one basis or for an entire crew or company. These programs are going to be focused on building flexibility, muscular size, strength, improving body composition, and improving the cardiovascular health as well. You can train as an individual at the station at your house, or you can train as a crew. And then lastly, we can do these either in person or via remote sessions through our app, through Zoom, through Skype, or any other means that can help us stay in communication throughout time. As a quick summary of all our speakers today, you must be enrolled in Santa Ana College to take advantage of these auxiliary programs through these office hours. And when you are enrolled, you'll have access to nutritional guidance, building resilience through injury prevention, and strength and conditioning. These sessions are going to be available either in person or remote via Zoom or Skype. And if you are interested in this, please contact our director and our coordinator, Christina Ross. Let her know that you're interested in one of these services here, again, nutrition, resilience building, injury prevention, or tactical strength and conditioning. And we'll make sure a Santa Ana College representative reaches out to you shortly. Thank you.